When you need medical attention, you get to go to see a doctor, and the doctor will decide whatever treatment is necessary, and either he takes care of you or you go to the hospital. Then, when you recover, you get to go home. Well, it's not easy for people that live in shelters or live on the streets, as I do. And becoming homeless, it can happen to anybody. You never could have told me when I graduated from college that I'd end up at the age of 56 living on the street like a stray cat.
We are here to make sure that men, women, and children who become homeless in Boston have access to the same good quality health care as you and I have. And they get it with dignity, and they get it in a system that has some of the highest quality medicine that America has to offer.
At Boston Healthcare for the Homeless, we provide services at over 80 different sites, and we see over 11,000 patients a year. We see our patients on street corners, we see them in shelters, we see them in day programs. We believe in a multidisciplinary approach so that a patient gets to know a nurse, an MD, a case manager, a psychiatrist, and they hand in hand see patients together so that they can address both their behavioral health needs and their medical needs.
We've been in our new building, and it's just wonderful to be here. It is so bright and so spacious. Our patients are able to come by subway or by bus, and also by foot. Most of them actually come by foot. We have clinics in several of the hospitals, at Mass General, at Boston Medical Center. We have an HIV team, a transgender clinic. We also have a pharmacy, a dental clinic. And the other great advantage is that it's across the street from the emergency room at Boston Medical Center.
I'm here at Barbara McGinnis because they found a mass in my lung.
I'm sick. I have pneumonia.
I broke my ankle.
I have neuropathy.
Pancreatitis.
Broken jaw. Brain surgery.
Alcoholism. AIDS.
We also have a street team that provides primary care to homeless men and women who, for whatever reason, won't come into shelter.
At nighttime, when everyone else goes to bed, that's when you can tell who's been staying out on the streets, and it's probably the most opportune time to come out and take care of people who are really street folks.
Our first goal back in the mid-1980s was to get out of the hospital and get our clinicians out to the places where homeless people would be, because we found that if we didn't get to them, by the time they got to us, it was too late.
Things happen, things happen. I've been out here 38 years. This is my dog for a long time.
As they begin to trust us, they will come to see us in the clinics. And over time, everybody gets to know who you are. So they're coming to see the individual. So we're learning that that has really helped with continuity. And the McGinnis House has been basically our salvation. So when somebody here is really sick or getting sick but won't go to the hospital, afraid of the emergency room, most of them are very comfortable about coming over to McGinnis House. I think it's a place where they can feel comfortable, don't feel pressured, not judged, and we can deliver some pretty good care while they're there.
How we take care of individuals who are the most vulnerable among our society really says to us as a society, what values have we chosen? So one of the reasons I like working here is because this is a group of people who said it's important to take care of people who've fallen down. And it doesn't matter what the reason is they've fallen down, but they've fallen down and they need their help, and we'd hope that somebody would do the same for us if we were in that case.
I think you learn very quickly when you start working here that if a patient falls down, we're there to pick them up. They fall down again, we'll pick them up again. And nobody ever loses hope, because we never know when it's going to be the time that someone is going to get the strength inside of themselves to make the changes needed in their lives.
Hey, good luck. Take care of that.
Bless you.
See you later. All right.
Thank you, doctor. Thank you, guys.
What you start to realize is that you get attached to the people. It's the stories that kind of grab you. And then pretty soon you start to see someone who would have looked on the surface as you walk by as just somebody who's doing too many drugs or a bum outside, and all of a sudden you see the person behind it. And you start to realize that the struggle they have is actually one that would probably break you or me, and that they've somehow been able to cope with that, and that's what they continue to struggle with. And I think it's the stories and the relationships and that sort of keep us involved.
You can get off your feet the care that you need. And hey, baby, you can turn your life around to bottom. Doc, my legs are hurting, my eyes are going blind. I got a pain in my heart and I'm slowly losing my mind. Surely you can help me. You see, I'm only 32.